All right, switching up your exercise routine, it can be good for overcoming a plateau, but changes can also lead to new risks for injury. And it actually may be hard to tell if the pain that you're feeling comes from simple soreness, like I would feel because I never exercise, or an actual injury. Well, experts say it's important to know the difference. Dr. Devi Nampiaparampil from the NYU School of Medicine joins me now. All right, first, people need to know the difference.
Sure.
Soreness is when you feel sore for 1 to 3 days. It should go away, but if it goes after 3 days, then maybe you've injured yourself.
That's true. So if the pain's not getting better or if it seems to be getting worse, then it's worth getting checked out. I mean, sometimes you don't want to wait that long, right? Because you might be in pain already. So let's say you're exercising and suddenly you feel a pain come on or you hear something, popping or twisting or even cracking. I mean, then you don't have to wait several days. You can go get checked out right away. I mean, I usually tell people, because most injuries come up when they change their routine or if they go from not exercising to suddenly exercising, to at least try to take some steps beforehand, right?
Like exercising. I mean, if you're going to do that, you definitely need to stretch. That's one way that you can really injure yourself, by not stretching. Runners especially.
Sure, and even runners, I mean, if you go from running on the treadmill to suddenly running outside.
Oh, totally different.
It's totally different because the treadmill is usually moving the floor beneath you, right? Whereas you have to propel yourself outside, so you can injure your torso. The impact from the surface you're running on could be different. So even minor things that you might not think about might make a difference. So I tell people, stop by your doctor. Just make sure, even aside from muscle injuries, people can be at risk for having heart attacks and other things, right? Especially if they have high blood pressure, high cholesterol. Just get checked out beforehand. Make sure you have no restrictions. If you're pregnant, make sure there's certain exercises you can't do. And then also, let's say you have low back pain or you have arthritis somewhere that kind of flares up. Work those muscles a little bit beforehand. So not pushing yourself to the limit, but just do gentle exercises for a few weeks before you start your new routine, just to get those muscles accustomed to the new regimen.
So what do we need to know heading into these cooler months? Because a lot of us are going to go from exercising indoors to going outdoors, and we just described, running indoor on a treadmill, and the air conditioning isn't necessarily the same as going outdoors. Do we see a lot of injuries when the weather cools off a little bit?
We do sometimes. I mean, but we do see a lot of changes whenever people change their routine, whatever that is, or if they go to suddenly doing exercise because they want to get in shape. I mean, I usually tell people, start low, go slow, right? So whatever you think is your limit, start a little bit lower than that, something that's totally doable. I mean, it helps for a couple things because you can keep doing it. And second, once your body gets adjusted, just go up by 10%. So when we say 10%, either 10% the distance if you're running, 10% the intensity, or 10% of the time, but go up in small increments.
Going out too strong is always a problem.
Of course.
I'm a runner. I was a runner. I used to do marathons. I haven't run in forever. And then when I go running in my head, I want to be the way I used to be. As you get older, you cannot do that.
You can't.
You really can't. So you really do need to take it slow. And your body does catch up quickly. But if you go ahead of it, it's sort of like you have to be in advance of the pain.
I agree. And then if you think that you're injured, I mean, some of the other signs, of course, are if you have, let's say, any weakness, like you feel like it's difficult to move, if you're having any numbness, so symptoms besides pain, any bruising or discoloration, I mean, these are signs to get checked out because it could be a more serious injury. And then, of course, you have to choose between the ER or, let's say, the primary care physician, right? So if you have any serious issue or you're concerned about you can't walk or something else, of course, go to the ER and look for the life-threatening or dangerous issues. But if it's something more chronic, like you have chronic low back pain and you feel like you might have re-injured yourself, then you might be better off going to the primary care physician because they know you at least.
Okay. Dr. Devi, thank you very much. I appreciate it. Now I need to start exercising. I'll start slow, like 5 minutes a month. I don't want to overdo it.